When it comes to infertility, a lot of focus is on women, but what some doctors are finding out is that 50% of the issue is related to male infertility. Here to tell us more is Dr. Moffitt with the Arizona Reproductive Medicine Specialist. How are you, sir?
Good, good.
Okay, I just said right there, 50% of some infertility is the men's problem. And when women come and get tested, they feel like it's them, it's their fault. But as you just said, we got to come and get tested.
Yeah, it's really hard to get our guys to come in, but you know, it's unfortunate. We'll spend a lot of time getting the woman ready, and then boom, at the end we'll find out it's a male problem. So.
Okay, so let's talk about why males are having infertility issues.
So some things are sort of genetic and irreversible, but some things are reversible. Sperm develop in about a 90-day period of time, and so if we can intervene and change it, it'll improve. So for example, smoking, overweight, alcohol, drugs, those can all suppress your sperm count. Also, the heat can suppress your sperm count. In the summer, when we have somebody who's out in the heat a lot, that can drop their sperm count, and it'll take about 90 days to come back.
Yeah. Okay, you said the heat, and I know we're here in Arizona, we kind of like have heat all the time. So it's really also if you're working indoors or doing things and it's hot in there, that's something you need to watch out for.
Well, yeah, but we're talking about, you know, significant heat, greater than 100 degrees, you know, that type of thing. If you're working indoors, you're going to be fine.
So,
yeah.
We also talk about the guys who are out riding bikes, doing things like that.
Right, right. So anything, occlusive underwear and being out in the heat. So the biker who's at noon riding with those biker pants, that's a big issue. Also, a postal worker, you know, they're outside and sitting on really a hot seat, and that's going to be a problem.
Now, okay, so is this able to be fixed? I mean, after taking the test and looking and seeing?
So when we figure out the problem, the good news is sperm develop on a 90-day cycle. So if we can eliminate that, most of the time it'll improve. The other thing that's a big problem is testosterone replacement therapy. You can't be on the radio for more than 2 minutes without hearing an ad saying, hey, you got these symptoms, go on testosterone replacement therapy. But the problem there is it suppresses the sperm count a lot. So if you're wanting to have kids or thinking of in the near future, you just got to not take that. And if you're on it, you need to stop it. About 90 days, it'll come back.
So, all right, let's talk about people coming in. A lot of guys don't want to come in, but they say, you know, listen, if you're going to be starting a family, she's coming in, they need to come in too.
Absolutely. I mean, that's the first thing we order, so it's just getting those guys to come in, that's the problem.
So, all right, so now what's some things guys can do going forward? You said to, of course, watch the smoking, losing weight. Are there things that they can do?
You know, healthy eating and keeping your diet under control. And then there are some at-home tests that we'll talk about in another segment that you can do the sperm count at home and find out.
Yeah, I think the other big part is just talking, coming in and sitting down talking and trying not to be embarrassed about it. But I think it's definitely going to help both them have a healthy family.
Yeah, and the good news is we have excellent treatments. Even if it's a genetic problem, we can get around it. We just need to know it so we can get around it.
I like that. Doctor, where can people find more information?
ArizonaFertility.com.
There it is. I like that. Also, too, you can head over to the CW7AZ.com for more information. Thank you, Doctor, for coming in.